Hi guys, my name is Magda Mensi. I come from Italy. Probably someone of you know about me. I'm a professor and researcher in periodontology and oral surgery at University of Brescia in the north of Italy. And today I'm here in Lyon in the headquarters of EMS because I want to share with you some issues, some topics and some tips and tricks about the GBT machine and the GBT protocol in a specific context that is maintenance of implants and the treatment of biological complication. This is a very huge chapter of dentistry and a very important issue because you know that we place millions of implants all over the world every year, and we have a very high prevalence and incidence of biological complications in terms of mucositis and periimplantitis, like 25–30% of periimplantitis in terms of prevalences, and 50% of mucositis. So that's a huge problem if you think about the number. And moreover, we have another big problem that is related to the guideline in the treatment of mucositis and periimplantitis. We don't have any specific gold standard treatments and a very strong evidence-based literature about this problem. So we need to adapt the protocols in terms of non-surgical and surgical approach of the treatment according to the specific clinical case every day. The technology, the EMS technology, and the protocol that we used is really very efficient in the prevention of the problem, but also in the treatment of the problem. Why? So I have been working on these issues since 2013 when erythritol powder arrived in the Italian market, and I tried to adapt the combination of use of powders and PEDS technology on the treatment of mucositis and periimplantitis. Why? Because we know that one of the cause of periimplantitis is the accumulation of biofilm around the implant in the transmucosal tunnel on the abutment of our implants. It's not the only reason of periimplantitis, because periimplantitis is a multi-factor pathology, of course. But what we can do, and our dental hygienists can do to help our patient in maintaining healthy their implants, is to disgregate periodically and effectively and properly the biofilm around the crown, the restoration on implants, and in the implant sulcus. But we have a problem, that is which kind of tools we can use on those materials, because we have at least 3 different materials when we have an implant: titanium, zirconium, and ceramics. Feldspathic ceramics, disilicate, or other ceramics, but we have 3 different materials that are very delicate and are very smooth in the transmucosal tunnel, so where they need to touch the epithelium, the junctional epithelium, and connective tissues. And we need to maintain, to keep smooth those parts to avoid accumulation of biofilm. If you use incorrect instrument like the stainless steel tips or stainless steel curette, but also some kind of titanium curette, you could be efficient in biofilm removal and calculus removal, but you will create some roughness, porosities, or scratches on those surfaces. And this increases the accumulation of biofilm during the time. But not only that, you can create chipping in ceramics, you can create some break on the materials, creating restorative problems. So what we do with the powders and with the specific tips is to be effective but not aggressive. The erythritol powder, that is the plus powder in the EMS technology, is very well demonstrated to be safe on all those three materials, zirconia, titanium, and ceramics, but also on composites, if you work with composites. And I worked with my research group on this in the in vitro studies, so I can confirm that we have no damage on those surfaces when you use properly the machine and the powder. But at the same time, is efficient, is extremely efficient in the biofilm removal on those surfaces. And even more, speaking about the powders, you can deliver the powder, so the particles, also along the threads of the implants when you need to go into a pocket around the implant when you have a mucositis or periimplantitis, and work also between the threads of the implants. How you can do that, not with the airflow, so not with the supragingival NPs, but with the subgingival NPs, so the Perioflow nozzles. That is this plastic tip that can deliver the powder from the bottom of the tip, and it is very flexible, so you can also reach a very deep pocket, even if you have some over contouring of the restorative margin. And you can go through the pocket. I don't know if it is possible to see in the camera, and work up and down very gently, and deliver the particles not just on the external part of the thread, but also between the threads. That is a very tricky part of the implant to clean, because it's impossible with rigid instruments to remove the biofilm inside here. You can work in the external part, but not in the internal part. So this is, I think, the most important instruments when you need to approach to face periimplantitis and initial periimplantitis, and you need to treat non-surgical the problem. But it's not enough, because sometimes you can have also calculus, or you can have residual of cement. That is a big problem when you work with cemented restoration on implant in the transmucosal tunnel or between the first threads in the coronal part. In that case, you need to use another instrument, that is an ultrasound, a piezo instrument, but not the conventional stainless steel tip. You need some tip like this, that is the PI mass tip, that is a PIC and carbon tip. So a polyether ketone tip with 30% of carbon. So the consistence of this tip is enough strong to remove, to disaggregate the calculus, but enough gentle not to damage the titanium, zirconia, and or ceramics. And this tip is very efficient, so I recommend you to work gently into the transmucosal tunnel like this. The movement is a linear movement like the PS tip or a conventional instruments, ultrasound instruments, but it is important to work in modality 2 of the GBT machine. Modality 2 is the best setup, the best setting that you can have to work efficiently but gently. You can also sometimes reduce the powder, so move down in the one modality if you want to be more delicate. And this is important also when you use the Perioflow nozzles. Why? Because I know that a lot of colleagues, especially dental hygienists, sometimes are afraid in using the Perioflow nozzles, because you are delivering not just powder and water, but also air into the soft tissues. And if you have an inflamed soft tissue here, you risk to create emphysema in the area delivering the air. But be safe using the right modality. If you work between 1 and 2, the pressure, so the bar that you are delivering here, is not enough to create an emphysema. So the important thing is to work with the right setup. And if you have more inflamed tissues, like an acute periimplantitis, with a fistula, with suppuration, with a very big swelling, you can work in one modality and move very gently and stop the activity every 5 seconds. So you can leave the time to recover to the soft tissue. You can remove gently the biofilm, and you can prepare your soft tissues for a second treatment after 1 week or 10 days, where you can use the right modality, so modality 2. So it's important when you approach the maintenance of your implants and the treatment of mucositis and periimplantitis to understand what kind of instrument to use and how to use the device that you have. I think that who already knows the airflow prophylaxis master and the GBT protocols, of course, know how to use the step of the GBT, the assessment, the disclosing, the education to the patient, the use of airflow, the use of Perioflow, the PS and PS or PI, the check at the end of the treatment, and the recall appointment according to the risk assessment. But when we are talking about implants, we have something different. An implant is not a tooth. We don't have the periodontal ligament. We don't have blood sustainment of the soft tissues as we have around the tooth. So we need to be more careful when we follow our patient with implant. We need to recall our patient frequently, at least every 3 months. So when you have a safe protocol, like the GBT protocol, gentle and effective, and you plan an implant surgery, you can add the quarterly recall appointment to your patient to guarantee the success in a long term with a good maintenance protocol. And don't forget that when you use this protocol, you need also to focus on the step 2 and 3 that regard the education, information, and motivation of your patient and how to remove the supragingival biofilm at home. It's part of the protocol. You have different steps. We always follow the same steps every time the patient comes back, and he can understand every time something more, improve the capacity to maintain at home the biofilm removal, and you can check and intercept very early the problem, because at the end, the best treatment of periimplantitis is the prevention. And the prevention means to assess and check our patient periodically, so use the probe every time. Try to look at the soft tissues, so visual inspection, and intercept, identify the initial problem, so the initial mucositis, because if you treat the mucositis and you treat effectively the mucositis, you can avoid the periimplantitis. And how to treat a mucositis? Of course, dislocating the biofilm with the airflow and Perioflow, and remove the cause of mucositis if there is any remnants in the sulcus with the PI tips. Because when you move into a more severe problem like periimplantitis, we don't have the opportunity, the possibility to be sure to be successful in the treatment. We start with a non-surgical treatment, of course, as we do in the mucositis treatment, but then sometimes we need a step 3, so a surgery around the implant. And a surgery around the implant is not so successful as around the tooth. So the best thing is to prevent the problem, intercept the problem, and maintain the patient. And remember that there is no difference in terms of long-time term success when we compare non-surgical approach and surgical approach. Because it depends from any specific situation, and it depends from the possibility to remove effectively the biofilm from the surface. So if you don't have the right instruments, if you are not able to guarantee the biofilm removal, you can have success neither surgery from a surgery point of view, neither a non-surgery surgical point of view. And the last thing that I want to share with you is the primordial prevention that is related to the success of our implants. So of course, we need to have the right instruments. Of course, we need to know how to combine the use of powders, piezo, and eventually local antibiotics or antimicrobial to treat and maintain our implants. But before this, there is a very deep and careful planification plan, treatment plan of our patient. That means control the risk factor of our patients, control the bad habits of our patient, treat the periodontitis in our patient before placing implants, follow the modern and the evidence-based biological, surgical, and prosthodontic rules when we place implants, because any implants need a specific digital plan to be prosthodontically guided, but also biologically guided. And when we are sure that everything is good, so the implant is very well placed, the prosthodontic shapes are good, the profiles are good, the selection of materials are good, we can schedule a periodical GBT follow-up to maintain healthy our implant and to intercept early the small problem. It's not so easy to understand how to manage mucositis and periimplantitis if you don't know how the implant were placed. So I mean, if it is a cemented work, if it is a screw retained work, if we have a secondary component in the prosthodontic work, if it is on a multi-unit abutment, or we don't have a multi-unit abutment. So my recommendation is to study the problem, know the problems, cooperate between dentists and dental hygienists and technicians, and have the right maintenance program with the right tools and devices and technologies. So if you have any question, I'm here. You can write your question, they can report the question, and I will try to answer.
So thank you, Professor Nancy. We got one question from Germany. So it's coming from Marion. When using the Piezo PI Max, do you sometimes switch from water to CHX? What advantages do you see in clinical outcomes?
So when I use the PI Max, what is the question?
Do you sometimes switch from water to CHX? What advantages do you see?
What is HX?
CHX.
Chlorhexidine.
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 Yeah.
Okay. If I use the chlorhexidine inside and bottle with the PI Max.
Yeah.
So no. Okay. Thank you for the question. I don't use chlorhexidine in the bottle of the water for two reasons. The first is very practical. When you place the chlorhexidine in the bottle and you use the Piezo PI Max or the PS, if you are working around the teeth, you create a lot of foam, and you are not able to see very clear where you are working. And the second reason, so I prefer to use just water and very limpid water. And the second reason is that there are no evidence about the improvement, clinical benefits, adding the chlorhexidine at the water when you work professionally. Even in the perio and in peri-implant problems. The only reason and the unique moment when I use the chlorhexidine 0.02% is after the treatment at home, just for 2 weeks after the treatment. If you have acute inflammation with the mouth washing two times per day for 15 days, because this is very well proved that can increase the benefit in terms of bleeding on probing, reducing bleeding on probing in the first time of healing.
We got another questions. This is a very interesting one. Do you integrate the GBT before or during peri-implantitis surgery? And what benefits have you seen?
This is very interesting. And yes, I use GBT before, always, because as you know, the first step of a treatment is the non-surgical approach. So as we do before a periodontal surgery, we perform a GBT session, at least one GBT session 1 week before the surgery, to have your patient very clean, very well prepared to the surgery, and with a very good soft tissue condition before the surgery, because it's mandatory to cut your gum with a scalpel and to suture in a very stable soft tissue. But also I use the airflow during the surgery. So if you need to open a flap to make a resective surgery or to make a regenerative surgery around implants, of course, the best method to clean the threads, to remove the biofilm from the threads, is to use the erythritol powder. And in that case, you have a very good visibility because your flap is open. You remove your granulation tissue. You see your flap. You can also place the disclosure on the threads so you can see the biofilm. And then you use the airflow without any problem, because you are looking at the sides. And the recommendation is to use the airflow with an inclination from apical to coronal, trying to avoid to place and to push the air underneath the flap. But yes, I use before and during.
There's another question on TikTok this time.
Yeah.
So thank you, Adam. Many times when I use erythritol plus powder, the clumps of the powder fall on teeth. Why? Clumps, we checked, is like group.
Yeah. Okay, yes. That's a problem of setup of the machine. If you are using the airflow prophylaxis master, so the version of the machine before the GBT machine, you need to set up 10 different powers modalities and 10 different water modalities. The best combination to have flow of powder, waters, and air without any accumulation on the tooth is to have 4-5 of power, so 50% in terms of powers, and maximum, so 10 or 9 or 10 in terms of quantity of water. And the second problem, because if you place too much power and powder and less water, so for example 7 or 6, sometimes you have accumulation of powder because there is too much powder in the mix, in the flow. The second reason is the distance of the handpiece, so the airflow handpiece, to the tooth or to the implant. If you stay too much close to the tooth, you can create accumulation. So you need just to stay at 3 millimeters to 3 millimeters, not less, because if not, you are not effective, because the powder has no the velocity to impact on the surface, and you have the accumulation. So probably is this problem.
Thank you. There's another question, this time from Instagram. Will Piezo PI tool remove cement, which was used to cement a cement retained restoration? So this is
yes. I think that the question is if the PI Max is able to remove the remnants of cement when you are working with cemented crown restoration. Yes, of course. This is the first indication in using the PI Max tip, because and thanks for this question, that the remnants of cement in the tunnel, in the transmucosal tunnel, is probably the first cause, the first reason of mucositis and periimplantitis. Because it's impossible, it's quite almost impossible to remove all the cementum when you make your cementation. So I recommend, if you usually work with the cemented restoration around implants, immediately after the cementation, to use the PI Max in modality 1 to remove the exceeding cement, and make an X-ray to see if you don't have any remnants, mesial or distal. If you have something, move in modality 2 and remove it. And the other recommendation is try the PI Max on the training kit that EMS gives you with the machine. The training kit is a tube. Yes, I can show if you have it. The tube there is this tube. In this case, you have this in the box. Sorry, and this is the tube with the calculus simulator. This is like a calculus or like a cementum. If you want to see if this tip is effective in removing calculus and in removing cementum, try on that. And you can also be comfortable with the regulation of the setup of the machine. So with the GBT machine, it's easier because you work in the 90% of the cases in modality 2, in modality GBT, is already regulated to be very effective. But if you have the prophylaxis master and you need to choose if you work, in 1, 2, 3, or 4 power, try on that and you will see how much effective is the PI Max. I use also round teeth, to be honest, especially on children or in some delicate soft tissues. It's delicate but effective.
Great. We see if there are other questions. Nothing here. Maybe let's wait one more second. Another comment from Marion saying, "Thank you so much, Professor Macy. Could listen to you for hours."
So, thank you so much. It's hot here, so I want to remove my jacket, but anyway, I can resist other 5 minutes, not more.
We got one here on TikTok. How many times a year can erythritol powder be used at most?
So there are no data about the maximum number of times you can use the erythritol powder in patient, to be honest. But in the study, in the clinical study, the recall that we do and without any clinical or prosthodontical problem is every 3 months. In the in vitro study, we did treatment to simulate very frequent recall, as we recall the patient every month. And in the in vitro study, there are no damage or no problem, even if you recall a patient every month. To be sure, my recommendation is to recall and use the powder every 3 months.
There's one more here. Hello, I have the previous airflow machine. At what power do you recommend using the Perioflow for implant cleaning?
That's a good question. With the previous version, the best setup to be effective is to use 6, 7 in terms of power and maximum water. This is the best combination. But so I have been working on that topic since a long time, and I need to be honest with you. It depends from the clinical condition of the soft tissue. If you are in an initial therapy, when you have an acute, a very acute and inflamed situation, my recommendation is to decrease the power and work like a 3, 4, and a little less water, like 5, 6. So it's very delicate, just to wash the pocket, to remove eventually the foreign bodies, apply a local antimicrobial or antibiotics and recall your patient 1 week later. So the soft tissue will be more consistent. And in that session, work with the right combination of settings. So 6, 7 in power and 7, 8 in water.
There's one more question. Can classic powder be used every 3 months?
Yes, just on enamel. That's important because the bicarbonate, even the EMS bicarbonate, is very delicate because of just 40 microns particles. It's dangerous on cementum, dentin, and soft tissues. So you need to work just on very strong pigment stains on enamel. But in that case, no problem at all, even if you repeat the treatment.
There's one more question. Can be used hydrogen peroxide on bleeding gums after using airflow?
Yes, you can, of course. I don't like to use peroxide because it's a very strong treatment on the soft tissue. So I prefer to use other essential oil to reduce the bleeding. But yes, of course, there are no problem in terms of interaction with the plus powder.
Okay, thank you.
Okay, thank you so much, and have a good evening. And thank you for this support. And see you the next time.